Welcome again, sir. And today's
Thank you.
talk, we are focusing on medicines in mountains. So we are all aware of the, various conditions that can develop during a mountaineering expedition or high altitude otherwise, HAPE, HACE, AMS. And so today, specifically, we will, dive deep into medicines, which can be preventive as well as, deal with the symptoms once high altitude kicks in. So, sir, very good morning. Can you please give a brief introduction about yourself and then we shall
Yeah.
continue?
Hello, everyone. I am Captain G. Santosh Kumar. I'm a regimental medical officer at Nehru Institute of Mountaineering, Uttarkashi. I have been posted here since last 2 years. And after joining this institute, I have done my mountaineering. I have started my mountaineering journey. Before that, I didn't do even a small trek also. So after coming to this institute, I have done my basic mountaineering, advanced mountaineering, search and rescue, and method of instruction courses. And I have also done few expeditions to Mount Jogin 1 and 3 and Mount DKD 2 in the last month only. And I have also submitted one unnamed peak above 6,000 meters. So only it's been a very short journey for me in the mountaineering field, but still I accompany with the courses to the mountains every month. So we stayed there for about 15 days, and then we do ice craft, snow craft, and all these things at the altitude of 13 to 14,000 feet. So that's about my mountaineering journey.
Thank you, sir. And hoping a very good and informative session. So,
Yeah.
sir, my first question is like, uh, why does it at all, our body respond differently to same medicines at sea level and at altitude? And where is the, is there any distinction at above which altitude, we should, worry about the medicine reacting differently?
Yes, exactly. Our body behaves differently when we are on the high altitude. For example, above 2,500 or 3,000 meters above mean sea level. There are certain things like hypoxia is the main thing. When the altitude increases, there is chances of hypoxia, that is reduced oxygen level supply to our blood. And due to the hypoxia, our body tries to maintain uh, by increasing the respiratory rate. That is called hyperventilation, we say. Apart from that, we also have, because of the excessive walk or excessive exertion and all, our body loses so much of water content inside it. So that is dehydration. Because of all these things, our drugs also behaves differently when we are on the higher altitudes, because the drugs composition, it has to go inside, it has to first absorb from our body, and it has to get distributed in our body, and it has to get metabolized inside our body, and it has to excrete also. Because
Okay.
of all these things, hypoxia, hyperventilation, and dehydration, and all these kind of things, these drugs won't be able to absorb properly or metabolize properly, excrete properly. Because of these things, they behave in a different manner.
Mhm. So definitely, like the efficiency of the medicines that we are saying that at a sea level
Yeah,
will reduce.
decreases. Yes,
Mhm.
reduces.
Okay, that's interesting.
Yeah,
Oh, okay, sir. So these symptoms that we talk about, hypoxia, dehydration, and basically this is acclimatization, right?
yeah.
So can medicines replace acclimatization?
No, absolutely no. Medicines can't replace acclimatization, because, as you know, when we are on the mountains, proper acclimatization schedule is followed so that our body naturally gets acclimatized. Although they can help us to acclimatize in a much better way or in a faster manner, or they can reduce the symptoms which you might come across when we are on the higher altitude, but they can never be replaced to our routine acclimatization schedule. But this
Mm.
time you must have also read about uh, foreign expedition, Britishers
Yes.
expedition.
Yeah.
So they used xenon gas and then
Xenon gas.
summited Mount Everest within 5 days.
Yes.
London to London journey was only 1 week. So that is a thing which is coming up nowadays.
Mhm.
They had used xenon gas, which is a inert gas. So what it does is it increases the erythropoietin levels in our body. It is a
Mm.
hormone. Erythropoietin, when it increases, it also increases the erythrocytosis. That means red blood cells number will increase, because of which the oxygen supply to our blood will be more. The person
Mhm.
won't be able to will be able to acclimatize in a much better way, and then you will not feel fatigue or weakness when he is on the higher altitude.
Mhm.
And that xenon gas, it is also neuroprotective, so the person won't be having any acute mountain sickness or HAPE sickness, HACO symptoms. And it is also anti-inflammatory, because of which it doesn't have any HAPO symptoms also. So, but as a doctor, I would say it is good to for any expeditions and all. It is good to use so that you don't get to stay on that higher altitude, like above 8,000 meters and all, when you are on the Everest. But as a mountaineer, I feel our body should go gradually. It should acclimatize to that higher altitude.
Mhm. Right. Yeah. Absolutely. Xenon. Yes. Xenon is. I would say at best is still experimental, and but yes, they have proved it by climbing Everest. But it's
Yeah,
not, I believe, commonly available or
yeah.
Uh,
It is expensive,
yes.
and
It cannot be.
only the one who has very good amount of money,
Mm,
as we say, for a mountain to become a good mountaineer, you should have three M's. One is muscle, one is money, and one is good mental ability.
yes.
Yeah.
Absolutely. So Xenon is something altogether different, which is different and not so accessible to masses. What about Diamox, sir? Because we are seeing Diamox is pretty common among trekkers, and they use it before starting their trekking expedition or something. So what does it do inside the body, and when ideally it is most useful?
Okay. Before talking about the Diamox, may I tell you something different about Diamox? Okay.
Yes.
When we are on the higher altitude, what happens is there is a thing called arterial blood gas, okay, ABG we say, or acid base balance of the blood. When we are on the higher altitude, our blood becomes more alkaline, okay, or acidic at times. So when we are on the higher altitude, because of the high altitudes, our pH level of the blood, so it increases. That is alkaline. It goes to alkaline, and then the carbon dioxide levels in the blood, so it reduces because we breathe in a fast manner. So there is carbon dioxide washout,
Okay.
because of which it is called respiratory alkalosis happens. And at the same time, in order to reduce this carbon dioxide washout, our body produces more bicarbonate levels. Okay, so increase in the bicarbonate levels, there will be decrease in the carbon dioxide washout. That is a compensatory mechanism which is happening. So
Correct.
when we take the Diamox is also called as astazolamide normally in the another name. It belongs to a class of carbonic anhydrase inhibitor. So what it does is it increases the it decreases the renal absorption of bicarbonates, leading to more urine production. Thereby, the person will feel better when he takes Diamox, and it also corrects the breathing. It increases the deeper breathing rate, and it also corrects the nocturnal periodic breathing. You must have also experienced when we are on the higher altitude, we suddenly get up in the middle of the night and take a long or gasping breathing. That happens because of this only, because of less oxygen. So
Mhm.
it all corrects. Diamox corrects all these things.
So and so what's the ideal time? Like if a person is going for starting an expedition or trek, so when should they start taking it?
No, I would say we should not take any Diamox before.
Hmm.
Not at
Okay.
all required. See,
Hmm.
when you gradually ascend the some climb the mountain, so your body will acclimatize properly. So you have to ascend less than 2,000 feet per day. That's it. If you are ascending
Hmm.
in this way, you doesn't require any medicines at all. But if you are ascending at once, for example, if you are going for any search and rescue operations, if you are getting deployed from the helicopter at the altitude of 12,000, 14,000, like that, then you might require astazolamide. So I would say ideally 24 hours before any expeditions like this. So one day before you had to take Diamox of 250 mg tablet,
Mm-hmm.
and then
Mm-hmm.
you had to take the tablet throughout the ascent, and then you had to continue taking that tablet 48 hours after that, after reaching a certain height. That is the
Okay.
ideal thing. But we also give Diamox in case of acute mountain sickness.
Mm-hmm.
That means the person, after reaching certain height, for example, higher altitude, for 9,000, 10,000 feet above sea level, then they start having headache.
Mm-hmm.
Headache is also associated with the nausea, vomiting, dizziness, and also somebody will be having fatigue, weakness, and all kind of this. That's a normal acute mountain sickness. That's happening because we are losing so much of water content in our body. Because of the dehydration, many people get headache. So we suggest, I always suggest my trainees to drink more water. If you drink more water, you don't require any medicines at all, and the headache will subside within one day.
Mm-hmm.
So Diamox is not recommended to take when you are going for any trekking or any expeditions. If you are gradual ascending, that's more than enough.
Okay, good. Good. That's good to know. And like I will also like to point out to my our viewers that as Sir said, that time off is not very essential. If you follow the protocol, you can easily attain altitude without any issues. And sir, okay, is Diamox safe? Like if a person has some pre-existing conditions, so what are the conditions when a person should not take Diamox?
Diamox can be taken by everybody, but those who are pregnant, those who are lactating women, they should not take. And those who have sulfonamide antibiotics allergy, so they should not take these kind of medicines, because when they take it hampers, because sulfonamides and astazolamide, they belongs to this structure is same. Because of the similar structure, they have a cross reaction between them. So because of which there would be some allergic reactions like itching, hives, redness, or swelling of the lips or face or tongue. These kind of things, a reaction might happen, and at times it may also lead to anaphylaxis reaction. So
Okay.
in order to avoid, so better to not to take those who have sulfonamide antibiotic allergy.
And what's this anaphylaxis reaction just you mentioned? What is this about?
Severe allergic reaction is called anaphylaxis.
Okay.
Severe
So
allergic reaction where the
severe
person
allergy
won't be
reaction.
able to breathe properly.
Oh, okay. I mean, so
Yeah,
that's a severe condition of this. And so
yeah.
what is this sulfur drugs that you said? Why people take these drugs? I mean, in what conditions these drugs are taken? Just to understand like
Sulfonamide,
the context.
urinary tract infections,
Okay.
so they take these kind of drugs. Yeah,
Mhm. Other than these, it's pretty safe, Diamox.
yeah, it is. Yeah, it is safe. Yeah, no issues.
And so what the hydration aspect? As you said, like once you take Diamox, it induces urine loss, water loss from the
Yeah,
body.
yeah, yeah.
So what's the like? What will happen if a person takes time off but is not maintaining the correct hydration? So are there
So
any
obviously,
dangers to it?
yes, this Diamox acts also like a diuretic. Diuretic means which produces more urine. So when you are taking Diamox, so you tend to lose so much of water content in your body through your urine.
Mhm.
So if you are not drinking enough water, so you will lose so much of water content from your body. So you'll get dehydrated and you feel lethargic. You will feel weakness and all kind of things. That's why we say whenever we give Diamox medicines, we tell the patient to drink enough water. At least 4 to 5 liters of water per day is very essential in order to function properly on the higher altitudes.
Mhm. Okay, that's good
Otherwise,
to
they
know.
will
So
have dryness of the mouth, lips, and
mhm.
then dryness of the airways, and then fatigueness will be there.
Mhm. Yeah, dehydration definitely takes its toll. And so you just mentioned a few minutes back about headaches. So
Yeah.
can we come to that? So headache, as I understand, is pretty like it's a natural process of acclimatization. So how to distinguish which headache we need medicine and which headache is just temporary phase that will go with acclimatization, and which all medicines can be used for headache if at all like we need to take.
See, usually when we are on the higher altitudes, headache will be like frontal headache would be there,
Okay.
okay, or occipital headache would be there. So
Hmm.
it would be normal headache, not a throbbing one. Throbbing headache means the person will be feeling like somebody is hitting his head through a hammer. That is throbbing headache. So if it is there, then that is different. In mountain sickness, the headache will be associated with nausea and vomiting.
Hmm.
The person will have pukish, and then at times he might vomit also, and he will have dizziness, lightheadedness, and he will have weakness and all kind of things. That time he might just rest wherever he is, and then he may take proper rest, and then he can drink 4 to 5 liters of water, and then with proper hydration the headache will subside within few hours or within one day. If
Okay.
he's not, if the headache is not subsiding, then he might take normal tablet like what we take, Dolo 650 or paracetamol 500 mg 3 times a day. So that will also help him. So some people also take some other drugs like ibuprofen. So
Hmm.
ibuprofen, aspirin, naproxen, these three tablets they belongs to NSAIDs, non-steroidal anti-inflammatory drugs. So these drugs are also fine to take, and some drugs have these combinations, both the paracetamol and the NSAIDs. Like you must have heard Ibulab,
Yeah.
ibuprofen plus paracetamol. Some
Hmm.
tablets also have a paracetamol plus caffeine tablets, and
Hmm.
some also have a combination of paracetamol, caffeine plus aspirin. So these kind of combination medicines can also be taken to reduce the headache when you are on the higher altitude.
Okay.
But instead of taking all these medicines, your headache is not subsiding, you are having nausea, vomiting, dizziness, weakness. So then you have to go for Diamox tablets that will reduce the symptoms.
Okay.
That too, Diamox 250 mg twice a day when we are on the
Twice.
higher altitude. Yeah, it can be taken 125 mg thrice a day, but I usually give 250 mg twice a day.
Okay. So one of our audience is asking a question. If someone is severely allergic to all NSAIDs, will there be an adverse reaction if he takes any medication related to treating HAPE?
If someone is severely allergic to all NSAIDs, will there be any adverse reaction if he takes any medication related to treating HAP? In the HAP, we are taking nifedipine. So nifedipine is safe to take since it doesn't belong to NSAIDs. In HACE, we are taking dexamethasone, which is a steroid. So he can take that medicines along with Diamox. So we are not taking any NSAIDs to treat HAPE or HACE.
Okay.
I
So
hope
I think,
this
yeah.
explanation will clear the doubt.
Mhm. Yeah, because they are allergic to NSAIDs, but that we are not using to treat the
Yeah,
hepatitis. Okay.
yeah.
So also, sir, like you said, different painkillers. So is there any risk if we mix all these painkillers, or they're like compatible with each other, like ibuprofen, paracetamol, or you said para with caffeine? Is there any risk association, or that's fine?
See, already these combination medicines are available in the market.
Okay.
So it is safe to take anyway
Safe to
these
take.
ibuprofen, paracetamol tablets.
Hmm.
But if you really ask me which is better,
Hmm.
ibuprofen or paracetamol,
Yeah.
I would go with paracetamol. That is safest drug. That's
Okay.
why even in the corona, everybody started taking Dolo 650 as if it is a chocolate. So, but if you are taking ibuprofen as a medication for the headaches, then you should drink more water. Some studies have also said that it leads to more dehydration.
Hmm.
So, if you are taking ibuprofen, you have to drink more water. But paracetamol के साथ ऐसा कुछ है नहीं है. So it is very friendly
So
medicine.
paracetamol is like
Yeah,
a better option.
better option.
Okay.
Yeah,
Good. So also you were talking about that sleep, like lack of sleep or some sleep related issues at altitude. So
yeah.
what's your take on that? Like, is medicine needed? Like, if a person is not able to sleep, for days, then is there any medicine which can be taken, or
I
how is it?
think we should know the reason behind it, why the person is unable to sleep when he is on the higher altitude. As I just explained to you, when we are on the higher altitudes, our respiratory rate increases. Okay. And because of which we are losing so much of carbon dioxide. Carbon dioxide levels in the blood is reducing. That is called respiratory alkalosis. So our body has a mechanism. Okay. So in order to reduce the carbon dioxide levels are reducing. So our body has a mechanism to increase it. So when we sleep, during our deep sleep, so our body stops breathing for 5 to 10 seconds in order to correct this method, correct
Okay.
these levels.
Mm-hmm.
Okay, that will increase the carbon dioxide levels and decrease the oxygen levels. That is correction mechanism when we are on the sleep. So that times we suddenly get up at night and then take a deep breath. That is called apnea breath. Okay.
Mm-hmm.
So because of which the person will feel as if he is not slept properly at night, and he will have drowsiness when he gets up, and he will not be fresh when he's getting up early in the morning. So the reason behind it is he is not getting acclimatized properly. We have to address the reason first. If
Mm-hmm.
he directly takes the sleeping medications or sedatives like diazepam and all, so he's just looking after one thing, which is that sleeping problem, but he is not looking at the acclimatization problem. If he gets acclimatized properly, then he will obviously sleep properly and be having issues. So I would say you need not to take any proper sleeping pills when you are on the higher altitude. You just have to acclimatize properly. So Diamox will only help him. If he
Mm-hmm.
has to take Diamox tablets, if he is not getting sleep also, and he will be able to acclimatize properly in a proper way. And then if at all, even after taking Diamox, if he is not able to sleep properly, then he can go with other non-benzodiazepine tablets like zolpidem hai and then zoleplan hai. So these two tablets, they are safer, and they will not cause any kind of issues.
Okay. So these tablets are safer, and
Yeah.
like in how many days, like, or how many days one should wait, and, or what are the symptoms, what condition should one achieve and decide, yeah, okay, let's take the sleeping pill. Like, what will be those symptoms to decide factors?
After usually within 3 days, the person will acclimatize to the higher altitudes. So
Mm-hmm.
after that also, if he is unable to sleep properly, then we might go with the non-benzodiazepine tablets.
Okay,
Otherwise, not required.
not required.
We should
Okay,
also
so on the
know
viewers side,
why. Yeah.
yeah, please go ahead.
Yeah, we should also know why, what happens when we take these sedatives or sleeping pills.
Yeah, yeah.
Yeah, because as I said, when we are on the higher altitudes, because of the hypoxia, because of the less oxygen, we tend to breathe faster. Okay, our
Right.
respiratory rate increases, and we deep in a deeper way. We breathe in a deep way. So when we take these sedatives, this will act on the respiratory center of our brainstem. So
Mm-hmm.
that inhibits our breathing rate. That reduces the breathing rate. So which
Further.
is opposite, which
Mm.
gets worsened. So that's the reason we say not to take the sleeping pills or sedatives.
Okay, so if at all we have to take, we have to at least wait for 3 4 days before taking that step. And I'm sure, like we should always consult a doctor before taking any medicine.
Exactly.
Let's now come to one very hot topic. Like in mountains, it has always been present. Steroids. So, sir, first of all, like please explain what are steroids, what they do to a body, and what's the relevance of steroids in mountains? How to take, how not to take, what are the risks involved?
Okay. First, I'll say steroids are the medications, or they are the drugs which have the property of anti-inflammatory that will reduce the
Mm-hmm.
inflammation, and they are also immunosuppressants, and they are
Okay.
also growth stimulating drugs. Okay,
Mm-hmm.
so if any problem which we are having, like any severe immunos like severe problem in our body, so we tend to go with steroid medications. When we are on the higher altitude, especially the person who are having HAP symptoms,
Mm-hmm.
HACO symptoms, high altitude cerebral edema, symptoms like headache associated with nausea, vomiting, and then dizziness, weakness. And also there are two special indications for the HACO. That is, one is altered mental status. The person won't be able to uh, decide which is right, which is not. And then second one is ataxia, gait ataxia. The person won't be able to walk in a proper way. He'll be waggling here and there as if he has
Mm-hmm.
drunk. So when somebody sees these kind of issues, then we can decide that he has got HACO. At that time, we give steroids like dexamethasone. It belongs to a class of glucocorticoids. Okay, this actually what happens is this will inhibit the production of the inflammatory mediators. We have got some inflammatory mediators like prostaglandins or cytokines. So this will not make you feel like you are in a pain. For
Okay.
example, if you are getting exhausted, so if you take this medicine, you will not feel exhausted. Fatigue, you will not feel any fatigue. You'll feel as if you have got so much of strength to do any kind of work, or you can do any kind of work for prolonged time. That's
Mm-hmm.
the reason it is being prohibited by World Anti-Doping Agency as also in some athletic championships or in Olympics and all. So one should not directly go and take these medicines when symptoms occurs. First and foremost, the best option would be to descend the person down. That's the
Mm-hmm.
first medication I would say, and then to buy some time, because when you are on the higher altitude, you know that it is not feasible to evacuate the person all of a sudden, because there are so many challenges, because weather is not clear, it is snowing, it is night time, it is cold weather is there. So at that time, to buy some time to decrease the symptoms, so we do give these kind of steroids, so that our body the inflammation what's happening inside our body that reduces, and then the person feels better.
Mm-hmm.
Yeah,
Okay. So you said like the person feels that they can perform better, but
yeah, yeah.
actually, what is like the person should descend or like
Yes, he has to descend.
instead to descend?
He has
Okay.
to descend. We are
Mm-hmm.
buying some time. That's all.
By time. Okay.
Yeah, buying some time.
Yeah. So all the users like dexamethasone steroids are to buy time and to save life, and not for the summit, as doctors have pointed it out. So what are the risks involved? Okay, if somebody takes steroids or and still keeps going up. So what are the risks involved now?
Uh, if you if you're taking dexamethasone and start climbing up, so it is strongly discouraged. It is not recommended at all to do this. But if
Mm-hmm.
somebody is doing, because we know that there is a summit fever when you are on the
Yes,
mountain. So because we facing so much of hardship, we have reached certain height, and if somebody says आपको वापस जाना पड़ेगा, then we won't agree with them. So we start saying नहीं नहीं मुझे summit करके ही जाना है. No,
correct.
one should not do this, because when you take medications like dexamethasone, steroid medications, they have a masking effect. That means you have got that disease inside, you have got that illness, but the symptoms are getting reduced. As I already said, symptoms are reducing, and there is also chance of rebound effect. That means when you symptoms तो कम हो गए अभी, आपको जो भी हेडेक हो रहा था, dizziness, they are reduced. You feel that you are much better and you are able to climb, push for the
Okay.
summit. But when
Mm-hmm.
you reach the summit of when you reach certain height, then there is a chance of rebound of the symptoms what you had already got it before. So in order to avoid rebound effect and then masking effects, so we had to discourage the persons to go to a higher altitude after taking the dexamethasone tablet.
And how many hours does it buy us, sir?
Few hours, few hours only, not more than that, because the dose is like this. Initially, when you get to know that he has got cerebral edema symptoms, you have to give 8 mg tablet. It has got tablets, injections also. You can
Okay.
give tablets. Usually, we have a 8 mg tablet at once. 8 mg पहले खाने देना है, and then four
Mm-hmm.
mg every 6 hourly you have to give.
Okay.
So only 6 hours. Every 6 hours you have to keep on giving him 4 mg. So you have got only
Mm-hmm.
6 hours of time. So
6 hours.
in that 6 hours you have to bring him down,
So you have to
evacuate him
reduce
to
the
a lower
altitude.
altitude. Yeah.
Correct. Correct. Absolutely. That is like. So yes, I mean this was a like major concern. Even I have seen like people using dexamethasone to climb up. So please do not do that. It can
Yeah.
seriously risk your life.
Some people
So
they take these tablets before any marathon run ultra
Hmm.
marathon, half marathon. Nowadays, Ironman is also there. So
Hmm.
some people they do take this medication and then increase their performance. But I would say it is not needed. You are doing all these kind of activities to prove yourself only, not to prove the world. So
Hmm.
better
Yeah,
improve your stamina, improve your body, and then only go to these kind of expeditions or activities.
right. So another user has asked, नर्व प्रॉब्लम में कोर्स ज्वाइन कर सकते हैं क्या और ट्रैकिंग कर सकते हैं क्या? Is it clear?
Which nerve problem?
Yeah, exactly. Like even this is not clear for me to me.
Aarti
Okay,
Gupta, I know, madam. She had come for the basic, I think, advanced course at NIM.
okay, ma'am. If you can explain, I'm sure he will be very happy to respond. Sir, I think we have covered all, but there's one still topic which I see. There is stomach
Yeah.
discomfort, diarrhea, which is pretty common at altitudes. I would say I've seen a lot of people either they have loose motions, diarrhea, or they have constipations. So, what causes these, and how to deal with it, and like the ORS and electrolytes. Like, what's the difference between ORS, electrolytes, when to use what?
Okay. I'll first address why gastrointestinal problems occurs. Okay.
Yes.
When we are on the higher altitudes, obviously our body goes to so much of physiological changes inside us. Because of the
Yeah.
higher altitudes, what happens is the blood supply to the intestines or stomach that reduces because
Mm-hmm.
our body gets to know that you are doing so much of work or you are doing some other adventure activities wherein your vital organs like heart, brain, lungs, they require more of blood supply. So it reduces the blood supply to the intestinal blood and gives the blood supply to these vital organs. Thereby, so blood circulation has reduced to the stomach and then intestines. Thereby, you will have nausea symptoms and then abdominal pain and all. And when you are there, higher the altitudes, there will be less the atmospheric pressure, because of which the air which is there in the intestines starts expanding. Because of the less atmospheric pressure, air gets starts expanding. Because of which the person will be having bloating and then abdominal distension, flatulence, and all kind of problems. And also one more thing is when you are on the higher altitude, there will be change in the gut microflora. We have
Okay.
got good bacteria in our intestines. When you are on
Mm-hmm.
the higher altitude, this microflora bacteria number will also hampers, because of
Mm-hmm.
which your digestion won't occur in a proper way. So that's the reason people won't feel hungry. They will have vomiting, and because of a hygiene problem also, food hygiene and then water hygiene issues, they are there on the higher altitudes. And if we are not drinking proper water, if there are so many bacteria in that, if you are consuming without boiling it or without proper chlorination or without any purification, if you drink that same water, then it will create some stomach issues. So thereby you will have diarrhea, vomiting. First of all, we are facing the dehydration issues. After that, if you have any diarrhea and all, again it will cause the dehydration problems. That's the reason. First and foremost thing is precaution. What precaution you have to take? Wash your hands properly before having meals. When you're on the
Mm-hmm.
mountains, we tend to, because of the cold water, we are not we won't be able to wash our hands. That we are all experienced. But we have to wash our hands before having meals, and then we have to have a proper hygienic meals, that is cooked meals, not like Maggie or something. प्रॉपर कुक्ड दाल चावल भी खाओ लेकिन कुक करके गरम गरम खाना चाहिए. And then we have to start taking ORS, because ORS has got the necessary salts in it at a proportionate manner. So, in order to rehydrate our body, these salts like sodium, potassium, these are required so that the body doesn't loses water contents, and then it reabsorbs whichever is getting lost. So
Mm-hmm.
in order to do this, ORS is required. So ORS packets are available in the markets.
Yes.
Just add one packet in the 1 liter of water and keep drinking. keep consuming it. But I would also say that it is also very easy to make this ORS in your home also. You can do just take 6 spoons of sugar and half spoon of salt and mix it in
Mhm.
1 liter of water. That also acts as a ORS. But this proportion should be proper. 6 spoons of sugar and half spoon of salt.
Salt.
That will also act as a ORS that you can take. And about the constipation,
Yes.
many people they don't drink water because
Oh,
प्यास नहीं लगती है मैं कैसे पीऊँ because of the cold weather they you don't feel like having water
mhm.
but forcefully or some other way have to keep drinking water. That's the reason we say at our institute for the trainees you should have a water bottle with you all the time. So when you have a water bottle, it reminds you to drink water. So if you drink more water and if you had salad, vegetables, green leafy vegetables to your diet, then you will have fiber content in your diet so that the stool passes freely. No issues at all.
Okay. Okay. Thank you. So mainly constipation is the effect of less water intake, as I
Less
can
water
understand,
intake. Yeah.
and diarrhea can be multiple reasons. And so
Yeah.
this ORS, okay, ORS, the green packet that we get usually, like
Green,
uh,
orange,
yes,
anything.
correct,
Yeah.
absolutely. So we see the sports drinks as well, like the electrolytes, hydration packs, and all this. Are these two same or like there's some
No, no.
differences?
ORS is different than these sports drinks.
What are like
ORS
what's the
has proper, it is a scientifically proven powder. Okay.
okay?
So it has got proper amount of sodium, potassium, and glucose levels.
Hmm.
And उसका जो total osmolarity होता है उसका that is also fixed.
Okay,
245 milliosmoles per liter is there total.
okay. Hmm.
So when you compare ORS to these sports drinks have high levels of sugars in it.
Okay.
So basically, it is meant to drink for the normal day-to-day activities to increase your athletic performance and all. But
Mm-hmm.
it is not to be consumed when in case of dehydration. Yeah, both are different. You should
Both are
not
different.
mix it up. Both are different.
Yes.
Yeah,
So yeah, sports drink, energy drinks are mostly performance oriented, and while
performance
these are
oriented.
like to treat a condition like diarrhea, severe dehydration,
Yes.
those things.
Yeah.
Okay, fair enough. So
Yeah.
there's a question: how to differentiate between headache due to migraine or AMS or altitude? Like migraine and altitude,
Yeah.
like,
Yeah.
what's the difference
Yeah.
in headache?
First of all, in acute mountain sickness, they'll be having headache, okay, frontal or occipital headache associated with nausea, vomiting, and then he'll be having dizziness, weakness, and fatigue. All these kind of things. Whereas in HACO, high altitude cerebral edema, all these five things with altered mental status and gait ataxia, which I told you. In
Yes.
migraine, it is different. In migraine, it is sudden headache, one-sided headache, either right side or left side, one-sided headache, and it is also associated with nausea and vomiting, and it is also associated with aura. You will have some aura kind of things. You will feel something which is there in front of your eyes. That is aura,
Mm-hmm.
and the person will be it will be short at times, short duration, and then the person feels better when he and then the person will also have photophobia, and then you'll have the headache will increase listening to more sounds or more lights and all. So
Mm-hmm.
if this kind of headache is there, then it is migraine. So
Okay.
what have to do? They have to take some tablets like sumatriptan, rizatriptan are there, so they will help. Or vasograin tablets are there. Then they can go with these kind of tablets.
Mm-hmm. Nice. So another question: how toxins in body affects on summit push? Toxins. I'm not
Which
able to.
toxins?
Yeah, I'm not able to understand the question. If you can please mention what toxins, what's the meaning of toxins, then we can, I think, we can answer the question. Moving on to second question. We were advised to have garlic soup as traditional medicine to combat AMS symptoms, especially in Nepal. Yeah,
No,
okay, so garlic. So what is the
I
take
don't
on it?
know. Garlic soup.
Okay. Uh,
You can work at high altitude.
any specific food item that one should avoid at higher altitude to keep away stomach or digestive discomfort?
So I would say you should not consume more of salty or spicy foods. So that will result in diarrhea and constipation issues. So better to have very moderate kind of foods.
Hmm.
Does migraine medication work? Yes, they do work, ma'am, on when you are on the higher altitudes.
Hmm.
Yes, as I said, all the drugs have different mechanism of action. So when you are taking, you should not mix it up with other drugs. So you have to when you are taking migration medicine, you should not take any other medicines so that they don't react with each other when you are on the higher altitude.
Okay. And this is
Um,
like if somebody notices,
Great.
uh, okay, I think there's another question in between. If someone notices early signs of frostbite at high altitude, what immediate steps can help prevent the injury from getting worse? Uh, Sir, we have covered this in the last week's,
Anyways, I will
Insta Live.
answer this. Anyways, they
Yes,
have
yes.
asked the question. So, initial symptoms of frostbite would be tingling sensation or numbness in your fingertips or uh, earlobes or tip of the nose or any extremity or peripheries. So, if you find any tingling sensation or numbness, immediately you have to come to a safer place where the temperature is a little bit warmer. So if you are outside, then you have to start wearing multiple layers of clothing, or you can keep your arms, or usually it happens to your fingers. So you can keep your fingers under your arm so that your underarms are always warm. So that will give extra warmth to your peripheries, and you have to protect from external injuries because they are already fragile, and then there is so much of chances of extra harming if you continue to venture outside in that cold temperature. Immediately come inside the tent and then take a warm water of about 40 to 42 degrees Celsius and then dip that affected body parts in that warm water and let it thaw. Thaw means the numbness and then the tingling sensation should go. The blood vessels they have constricted, and because of when you dip inside the warm water, the blood circulation gets restored in that peripheries, and you start feeling better. And after that, also you should keep your hands and or affected body part uh, dry, and then you should not go out again. So you should avoid freeze thaw freeze cycle. एक बार फ्रीज हो गया, आपने थॉ कर ली, बाहर रख के फिर से फ्रीज नहीं होने देना है.
Okay.
So that is called freeze thaw freeze cycle. You should avoid that.
Hmm. Okay. Fair enough. Yeah. So I think we have answered this question. Does migraine medication work at high altitude? Another question is toxins created due to non-cleaning of stomach. Uh,
No, I didn't get
I,
it.
that is like a very
Matlab,
okay.
I think they're trying to say that when we eat food, it becomes toxic inside, and if we don't go for washroom, it becomes toxic inside our body. Is it like that?
Yeah. Maybe they are talking about food poisoning. I don't know,
Okay.
sir. That is like something
Anyways,
which.
what one medications I forgot to
Mhm.
inform. When you are
Sure.
getting this kind of any diarrhea and all, in order to stop, we take norfloxacin,
Mhm.
norfloxacin plus tinidazole. So this tablet you can take for twice a day for about 2 3 days. Then the diarrhea problem will reduce. You had to also take ORS drinks. So you had to keep consuming it for about 24 hours or so, and then your problem will be solved.
Okay. I hope that clears the query. Sir, okay. So we have, I think, discussed all the common medicines that are used in high altitude. So can you share your real life experience where, timely intervention of medicine, uh, saved the day, or, another instance where wrong use of medicine, made the condition worse?
Yes, it had happened with me recently. We were on a DKD2 summit, Draupadika
Okay.
Danda, which is at altitude of 5,670 meters. So I was the victim. So what had happened was I didn't acclimatize properly. Okay.
Okay.
So because I thought since I had been to that altitude 10 15 days ago only, so we have a rule. If we are coming from a higher altitudes, just within 10 to 15 days, you need not to acclimatize as per acclimatization schedule. Just 4 days.
Yes,
So
correct.
keeping it in my mind, I thought my body is already acclimatized. I can just push for the summit. So I just went from 10,000 feet to 12,000 feet and 12 to 14,000 feet in 2 days.
Okay.
Whereas I had to stop there for 4 days, but I did
Mhm.
I did cover this distance in 2 days, and then I submitted that mountain, and then I returned back safely, and then I slept that day in the tent in the advanced camp, and the next day, when I got up and then I came out of my tent to go to my washroom, I was unable to walk. I was unable to walk for 5 to 10 steps also. So I was having difficulty breathing, and then I was having shortness of breath, and I was having severe weakness. Then I went to MI room and then checked my saturation levels. It was 56.
Mhm.
So that time I got to know that I have got HAPO symptoms. Then best treatment is to descend first.
Yes.
But it was since it was morning and I knew that I will be able to safely descend. Then I went to the MI room and took the oxygen of about 10 liters continuously for 1 hour. And then I also took nifedipine tablet. We didn't discuss about the
Yes,
nifedipine.
nifedipine. Yes. Please, sir.
Nifedipine
It's
tablets,
good.
when HAPO happens, so there is a vasoconstriction of the pulmonary vessels, due to which you start feeling persistent cough with pinkish sputum. So persistent cough, pinkish sputum associated with shortness of breath, then that is HAPO. So I had no cough, no pinkish sputum, but I had only shortness of breath and saturation levels were low. So I took oxygen and then nifedipine. It comes in two types. One is nifedipine plain, 20 mg ka tablet hai, and nifedipine SR. SR is sustained release. So
Mhm.
it comes in 30 mg tablet. So if you are taking plain tablets, you have to take 3 times a day. If you are taking sustained tablet, you have to take twice a day. That is nifedipine 30 mg SR. Twice a day, I took that tablet and then came back to base camp safely. Stayed there one more day with oxygen support, and the next day I came back to NI. So that was the incident which happened with me. So I would say don't be overconfident. I think I was overconfident that my body is already acclimatized, so I need not to acclimatize. No, it can happen with anyone.
Yeah.
So you should be always listening to your body and then uh, follow the schedule. Yeah.
Mhm.
And about venous thrombosis, this also I should mention
Yes,
because it
sure.
happened with us. It happened with our principal of NIM. So he was totally fine before going to Everest.
Mhm.
So when he reached the Everest base camp, he submitted Mount Labuche, and then he was there for about 1 month or so, and then he developed venous thrombosis. That is,
Okay.
blood clot formation happens because of the higher altitudes. That is
Which part where like blood gets
in the
clot?
legs, in the lower limbs.
Lower limbs. Okay.
Yes, it happens. It usually happens in the lower limbs.
Lower limbs.
Okay. So because of the venous thrombosis, so it caused embolus to the brain, and then it got exploded over there, due to which he got right-sided brain stroke. So he's right now in the hospital. So he had got to know that he has pain in his lower limb, and the doctor also diagnosed it that he has this venous thrombosis problem. He should not push ahead, but somehow he pushed to the summit because of the summit fever or whatever, and he had sustained a brain stroke. So what I want to tell you is, so if you have got any mountain sickness, please don't neglect.
Yeah.
It can be life threatening. So it is very, very important to listen to your body and then listen to the doctor who is there at that altitude with you. So mountains are always there, so they are not going to go anywhere.
Yeah.
So we have got second chance to submit
Absolutely.
all the time. So it is better to come back and then treat ourselves.
Yes, that's the best advice even we give to all our, like athletes and everyone who joins us, that mountains will be there next year as well. So thank you very much, sir. It was really eye-opening and a very informative session. And with this, we'd like to close. So what we can, if I can summarize this entire, Insta live. Medicines are tools, they are not shortcuts. So we have to keep in mind that fitness comes first, then there is acclimatization that will protect you in mountains. And if at all you have to take medicine, then medicine is buying you time to come down,
Yeah,
not to go up.
exactly.
So with that, thank you very much. Thank you
Thank
to
you
all
so
the
much for
audience who has
hosting
joined
me. It
us.
was a wonderful interaction. I think
Thanks,
this
sir.
is my first Insta live. I had never been on Insta also. So
This was
I
great.
would like to thank Romil Battawal sir also for giving me this
Yes,
opportunity to interact with you and with all the participants who are there here.
sure, sir, sure,
Yeah,
sure. Definitely we'll meet next time. Thank you, sir. Thank
sure,
you. Bye bye.
sure. Thank you.